most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical
We're
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about hip pain, 15 signs that you need to see a doctor immediately. Let's get started, Brad.
There you go, Bob.
Number one, you're unable to put weight on it. This is certainly true if you went through some trauma or injury.
Exactly.
Like if you went through an athletic injury and you just can't take weight on it, I mean, that's of concern.
Right. Yeah, you've got to get in and see if it's fractured or something.
You don't
of
have
that
X-ray
nature.
vision, I'm sure, so you're going to need someone to take a look at it. Number two, kind of this along the same vein, you can't even move the leg or hip.
Right.
It's so painful.
Yeah.
Your body is going to naturally brace a limb if it's really injured.
Right. Exactly,
That's
Bob.
what's nice about the body. It's smarter than we are.
Yeah. You got to get it checked out. Doesn't mean that it's necessarily injured seriously, but you need to get it checked out and find out.
You need to get it rolled out. Number three, the joint appears deformed or it is bleeding. If you look at a joint and it looks angulated, I think people mostly know that you're going to go in to see the doctor then.
And when you're saying bleeding, you don't mean necessarily like the skin is ripped open, but internal bleeding?
Well, yeah, I have to be honest with you. This was off a list, a different list that I pulled off of, so I wasn't sure where they were headed with the bleeding.
Right.
Because you can see some bruising and bleeding, and I wouldn't go in necessarily. It does mean a more serious injury, by the way, when there is bruising.
Yeah. I had a friend, he fell on his. It was very dark and purple, so it was bleeding inside.
Right.
Not the skin.
So did he go in?
Actually, he didn't. I advised him to.
Sure.
But then I take that back. He did, but it took a little bit of
coercion?
a little persuasion, and
Sure.
He did, and everything was fine. But yeah, that was definitely internal bleeding.
It's one of those things where I'm kind of on the fence. I'm going to look at other factors.
Sure.
Like if someone's really young and they, you know what I mean?
Right.
And there's some bruising there. Maybe not.
Especially if there's an obvious cause. They fell on it.
Right.
You know, if it just comes without any apparent reason.
If they fell on it and they're still able to walk on it and they're still, you know what I mean? They're still able to move it. I probably won't go in.
Right.
So, number four, if you have severe back pain in addition to hip or leg, I would probably go in because that means it's especially after an injury, it's probably pretty severe.
Right. And
So-
there's too many things that it could be related to.
Yeah, you might also have numbness or tingling or pins and needles, and then we're thinking, of course, that you might have a herniated disc in your back.
Right.
Something from your back is pushing on the sciatic nerve.
Yeah, so he's talking about pins and needling pain going down the leg.
Right.
That's a red flag too.
Previous history of cancer or tumor. We just got some bad news. Former girlfriend of mine, I don't want to obviously say her name, but one of the first girls I ever dated, just found out she's got osteosarcoma, which is really weird because, I don't know if you remember this, Brad, that's a cancer in the bone. Usually young people get it, usually like 14, 15. So anyway, she broke her hip, not knowing what it was, and they found out that it was cancer.
That was terrible.
Number six, if hip pain came on suddenly for no apparent reason, that's always a red flag.
Yep.
And when we say a red flag, that means it's a warning signal to you that you probably should go in and see the doctor.
Go in and get it ruled out one way or another.
Yeah. Sudden swelling in the leg, kind of the same issue.
Right, either around the hip or down the leg.
Down the leg, right.
The hip could be causing the swelling, and gravity pulls that fluid downward.
Anytime, number 8, anytime pain in the hip is really intense, that again, your body's going to warn you. If something's really going on bad, it tends to really give you intense pain.
Right.
So you're going to go and check it in. Number 9, signs of infection, fever, chills, redness, warmth. That's where often you can get really pretty severe pain too with this infection.
Right. So I guess maybe we should clarify this. You have hip pain, and then along with that, not just, it might be warm to the touch around the hip, but your body may have a fever as a result of if it is an infection in the hip. So, the body really reacts to infections not just locally, but throughout the whole system.
Still amazed that my mother-in-law had an infection in her knee, and she went to the hospital 3 times, and they still didn't pick it up.
Yeah.
And she went to another hospital, and they picked it up within 10 seconds.
Yeah, so a second opinion or
Yeah,
different
just I don't know,
doctors
it's just
sometimes.
strange. Number 10, if you've had a fall or another injury that initiated the pain, especially again as you get older, then I'm always concerned. Of course, it's pretty easy to break a hip as you get up in our
Yes.
neck of the woods, right, Brad? Number 11, if you've had hip surgery in the past 6 months and you're having a lot of pain, you probably
Right.
should have it checked
Yep,
out.
absolutely.
Number 12, if you're a child and you have hip, groin, thigh pain without an injury.
Yep.
know,
We did a video on that actually.
Yep,
Um,
I remember you did that,
I'm
Brad.
trying to think of the name of it. Hip pain.
You're trying to remember the actual name of the video.
Yeah, but my memory is not.
It was a
that
fairly
good.
rare occurrence.
Yeah, it's not common, but
yeah. But when it happens, it happens.
yeah, and it's easy to rule out. Just a simple X-ray and yes or no.
right. If you're feeling unwell in addition to the hip pain, again, we're worried about something more ominous. If you've been feeling kind of crappy and all of a sudden you get hip pain along with it,
Yeah.
you may want to go in.
Yeah, the two may be related, and
Yeah.
just check it out.
Number 14, if you start hearing popping noise when you've injured it and you didn't hear popping noise before,
Particularly if there's pain associated with
Right.
the noise, then it's even more so.
it's
of a red
funny,
flag.
it's not necessarily true with a hip as much as you might do with a knee or even an ankle.
Sure.
But like athletic injuries, you'll hear a pop quite often. They say, I heard a pop and they tore ACL or
Right.
MCL or something like that. So number 15, if you've developed unexplained weakness in your leg,
Yeah.
that would be another reason to go in.
Exactly.
No, I guess that overall I would say if you just don't feel comfortable with it, go and see your doctor. I mean,
Sure.
it's so much easier to move forward and if you know that other things have been ruled out.
Exactly. It just
So-
that peace of mind is going to help you sleep, and that's going to help your hip get better, and
Yeah.
your nerves, and all those things. So
Yeah, by the way, this video is a series of videos, part of a series of videos on hip pain.
sure.
If you want to see the entire series, go to bobandbrad.com, go to the program section.
Right.
And under the program section, you'll see the hip series,
Yep.
and check it out. You'll see all different titles. Watch the ones that seem to apply to you.
Right. Yeah, you don't have to watch them all. That's for sure. That's the beauty of it. We don't take your email. It's completely
Nope,
free.
it's completely free.
And this is going to be a podcast too. It's
This one's going to be a podcast.
yeah.
too, yep.
So you can listen to us and watch our
Watch
watch
our
us at the
faces.
same time.
Yeah,
That'd
there
be
you go.
real double jeopardy.
Thanks for watching.